Let's give this patient some botulinum toxin for aesthetics and for oral facial pain because she has got both. She suffers from headaches, migraines, TMJ, oral facial pain, all comorbid conditions. Plus, she wants the aesthetic part of this too. So let's go ahead and show you what we are doing. We are treating the frontalis muscle there, and we are first going using ComfortDoc syringes to go ahead. Sharpest syringes out there, perfect for botulinum toxin. We are going through the skin to the muscle, and then underneath the muscle is bone, then that's the skull, so you want to stay away from that. You may touch a little bit, pull back, make sure you're not under the periosteum, and we are going to give her the required units that we determined for her. That could be anywhere from 6 to 20 units, depending on the patient, so this is very individualized, whether or not they have got some shallow, medium, or deep set eyes, and that really determines it, plus the muscle intensity, muscle mass, and everything else. Now the procerus glabellar area, that's the procerus muscle. We're going to go straight in for that. That's a short, beefy muscle, so definitely going to get a good dosage for that, and corrugators that bring things in, make those 11 lines, and that is going to get some good. Now watch how she is holding this. She's holding it very, very carefully here because we are going to isolate that botulinum toxin into the muscle there, and that is what is important there, because if I held this a different way, it could squeeze down to some other muscles, the eye opening muscles, which we don't want to get botulinum toxin, because then she would get an eyelid droop, and that's not what we want. So technique is everything here, and everything we're doing is very, very specific here, including when we go ahead and clean her up. You will see we are always going up and away from the eyes, pushing the botulinum toxin into the muscles that we want them to get into now. Now let's go ahead with the crow's feet here, and going to go ahead and do really kind of put some tension on the skin there. You'll get underneath there much better. As you can go ahead and see, you're going to just slip right underneath the tissue there. It's a little pinchy, that's for sure. These are all injections, but most patients tolerate this extremely well for this. It's not for the needle phobic patient, that's for sure. And as you can see, always away from the eyes. We want to get into the lateral orbicularis muscle. That's exactly what we're trying to do. This one is pretty much right underneath the skin, will put you into the muscle, so you really don't have to go anywhere else. Now, this is a very specialized injection for the mentalis muscle, not for beginners. You've got to really isolate. If you're not exact on this muscle, and also better to use a tight dilution many times, then you will get into other muscles, and then the patient's lower lip will droop. And she's got some beautiful lips from a lip enhancement. We don't want any drooping of that, so very specific. Now the masseter muscles, and this is really going to help her in terms of TMJ or oral facial pain, but also give a beautiful heart-shaped contour to her face by relaxing that masseter muscle. Some of the muscles we're taking out completely with botulinum toxin, not the masseter. We just want to reduce the intensity of the contraction. That's the most important thing to do with the masseter, and that is the facial muscles with botulinum toxin. Now let's go ahead and show you oral facial pain. Guess what? Some of it's coming from her trapezius muscle, and we're going to show you with a combination of lidocaine and botulinum toxin some trigger point injections here, and that's what we're doing. A trigger point is in this muscle, and it is referring pain up to her head, and that is part of her migraine and oral facial pain, and we're going to treat it. Yes, it's coming from the trapezius. You've got to get trained in trigger point therapy and evaluation and diagnosis how to find these trigger points. She pointed right to it, and then we did it with an examination. And what we are doing here is we are using a 22 gauge ComfortDoc needle, and with the solution of lidocaine and botulinum toxin, and we are breaking up that trigger point. We're actually feeling, almost feels like some scar tissue, some tough tissue, and we're feeling it with our needle tip, and it's like a scalpel that is poking through this scar tissue and breaking it up, and that's the trigger point that is referring pain to a faraway place on her head, and it's all coming from this because we can replicate it many times by pushing on the exact spot where she told us to go ahead and push on, and she feels the pain in her head, in her jaw, and that's why we're going to take care of these trigger points. We're really going to relax that head, the neck, the shoulders, all those different things. There's the other one, as you can see, so we're going to really isolate it. We feel it again, make sure that we are in the right spot. You can feel, you get good at feeling the tension and the muscles here. That's all part of AAFE training for trigger point therapy and botulinum toxin. Depending on the courses that we take, we have a specific course just for this. Then we go in there, we can feel it. You can see the drag on that needle tip as it is going into the tissue, and it gets stuck sometimes because it's driving through that hard tissue, breaking it up with the needle tip, which again, we're almost like an internal scalpel. Once you break that up, the body's inflammatory process will start to heal that on its own. And guess what? Her pain starts to go away. And this has really been taught in oral facial pain residencies and dental schools for 30 years, but adding botulinum toxin, that's the AAFE way and the AAFE protocol that we introduced about 12 years ago. That changes the whole dynamic because that will reduce the inflammation and reduce the drag on the tissue and on the muscle, and that is going to go ahead and really relax the muscle. Once you relax it, the body heals up so much better, and that is the combination of trigger point therapy and botulinum toxin, the AAFE way. And that it works wonders for patients. They get so much relief from this. It's really, really incredible. And here is that patient afterwards, and you can see much more relaxed. Now, we've also done a few things, cheeks and lips and many things. Look at her chin, much smoother, and that's why we gave that injection. But look at her face overall. You can see she's out of pain. You can see it's much more relaxed. You can see how much better she looks and feels. And here is a good view of her frontalis, trying to raise her eyebrows. You can see that it's nice and smooth now, but she still has some muscle action, so she looks normal. And she can still emote, and here she is smiling. You can see really, really beautiful result on this patient. So it's time for you to learn this for aesthetics and therapeutics. Make your patients look great and feel great. It's time for you to get AAFE certification trained today.